It is National Dentistry Week. That is right, National Dentistry Week. And let's be honest, most of us, we should floss and clean our teeth on a regular basis, but I suppose a lot of us don't actually do that. Today we're joined by someone who knows just how much damage we do when we skip the basics and how far dentistry has come over the years. Dr Garreth McBride is the founder of The Good Dentist in Newcastle. He's originally from Ireland. He trained in the United Kingdom and now runs one of the most people-focused practices in the country. Garreth, thank you for your time this afternoon.
Brent, lovely to chat with you, and thanks for having me on air with you.
It is a pleasure, mate. It is National Dentistry Week, a perfect time to talk about all things with oral health. Can I ask you, let's start with the basics. What are the top 3 habits that most Australians are getting wrong when it comes to dental health?
To be honest, Brent, I think we all obsess a little bit about, not flossing enough and, flossing at least once a day and all the rest of it. But it doesn't have to be flossing. But yeah, one of the things is we're not cleaning between our teeth enough. As I say, it doesn't have to be floss. It could be a Pixter interdental brush. It could be a water pick. There's so much out there, but it's actually, we're stopping or we're forgetting to brush a third of our teeth by not flossing or not using a little Pixter. The other thing is, I think too many Aussies are brushing too hard. We're all in a rush these days. We're all, clocking out in the mornings when we're brushing our teeth before work or before we get our day going. And we're actually starting to skip regular checkups that are really important in identifying early problems that we're having.
How big an impact is diet still having? Are sugary drinks and snacks the biggest culprit for tooth decay?
Oh yeah, diet's massive, and I think it's always going to be massive as things progress. The problem is we're now seeing a lot of these carbonated drinks that are, diet drinks or don't contain any sugar. The problem with a lot of these ones, Brent, is a lot of these drinks are very acidic, causing a lot of erosion to surface loss. And then we're coupling that with, a society we're grinding our teeth more, we're clenching, and that's resulting in more destruction of the teeth. So there are things that we can do, certainly, to improve and to, work around the increase in sugar in our diet, but it's just being aware and doing the simple stuff right. You
have my questions in front of you, obviously, because my next question was going to be to you about grinding teeth, and you've sort of answered it for me. So you are seeing more stress-related issues like grinding teeth and jaw pain?
Oh, yeah. I think for a couple of reasons, I think we're all under a little bit more stress as a society these days. I also think just my own personal thoughts are that a lot of us are working from home. I don't believe working from home can be the most healthy option. And, a lot of us are clenching and grinding. And a lot of us are a lot more aware, Brent, that we're doing it. And we're coming to the dentist or we're chatting with our friends. There's Dr Google out there, and more people are self-diagnosing that they have a clenching or a grinding habit. And they're waking up with headaches, or they're noticing broken teeth or worn teeth. There's definitely a bit of a pandemic of tooth grinding and tooth clenching out there. But that's what we're here for, to identify that, to help you through it, and prevent its impact on your teeth.
So you do get people coming to you, because I know one of the biggest bugbears of doctors is Dr Google. Patients come in and say, oh, doctor, I've Googled here and I've seen this and I've seen that. Do you get the same thing? Do people come in Googling, what's wrong with their teeth and say, look, I've Googled this?
I'm going to say something a little bit controversial, Brent. I actually think sometimes Google actually prevents patients from coming. It doesn't enlighten people or give people the benefit of knowing what's happening. A lot of the time, one of the big reasons why people put off coming to the dentist is, fear of what they think's happening. And sometimes we can Google things and self-diagnose things that aren't actually happening and not presenting to the dentist in a timely manner. So whilst that has its benefits in some respects, I definitely feel that in many other respects it works against a lot of people, unfortunately.
Let's talk about kids in dentistry. Are we getting better, or are we getting worse in reference to bringing kids into dentists on a regular basis and from the right age?
I definitely think it's got a lot better. I look at some of the kids that come to see us, and they love coming to the dentist. I think you'll see in a lot of dental clinics these days, there's TVs. Younger kids are watching their favourite show, their Bluey or whatever, Paw Patrol, whatever they're loving, and it's a lot healthier interaction because they're coming more regular than say their previous generations would have. And I think parents are a lot more aware of the impact of sugar. But like in terms of age, I don't think there's a particular. Everyone, asks, what age should I bring my little Johnny or little Charlotte in? The real answer for that is, a lot of the literature would say bring them in as soon as they get their first baby tooth. But for me, it has to be at a time when they're developed enough to be able to cope and deal with the stimulation of the environment of the dental clinic. So, for example, my little son, Frankie, he didn't come until he was 3 because I knew it would be too overwhelming for him. So, as you know, Brent, as a parent, your child better than anyone. So a lot of it is down to the thoughts of the parent,
Yeah, true. I wanted to ask you about a couple of things in reference to government involvement. I mean, as we know, we have Medicare in this country. What are dentists in Australia doing in reference to speaking with governments, trying to get dental as a part of Medicare in reference to so that, people that can't afford a dental checkup can go to you and not have to, find the money, beg, borrow or steal the money to pay for the procedure. The government looks after it. How far down the track are dentists in reference to achieving anything with governments?
Look, I know there's been lots of conversations by the ADA, and there's been certain parties have been pushing for a Medicare-funded service, whether it be a very skeleton-based service or a little bit more comprehensive. Look, I've worked in 3 different countries in my 20 years as a dentist. I've worked on the National Health Service for many years, and I have to say, Brent, in the future we may be looking at government funding related to dentistry in some respects, but it certainly doesn't come without its problems as well. It's very difficult to deliver a very comprehensive and efficient service funded that way. So I think we're still a good way off that yet. But I do feel a lot of society would benefit from it. And in fact, we're starting to see in the private sector a bit of a split happening where we're getting a two-tiered, almost like a two-tiered society regarding dentistry. We're having people coming in and they're spending a fortune to change things about their teeth, and other people are scrimping on things that are really necessary. So I do feel there's a need for it. It just has to be delivered in the right way, and I think we can probably learn from all the mistakes that they've made in the UK regarding the delivery of national health dentistry, and making sure that there is a big preventative component of it as well. I think it's really important that kids have fissure sealants done in their teeth. I feel it's super important that every adult has a 6-month checkup to mitigate the risk of decay that's just been sitting in teeth for years undetected. So yeah, I believe it could be a really good thing in the future for all Australians, but it just has to be done and delivered by the powers that be in the right way.
Gareth, you've said you've worked in 3 different countries, Ireland, UK, Australia now. How has dentistry changed for you over the years?
Oh, Brent, I'd say, 20 years ago, I remember being stuck in a little dark room developing x-rays, writing patient records on cards. Things have changed massively. I would say probably the biggest change that I've noticed comes in the form of one of my big passions in dentistry, which is dental implants. We're now able to place a dental implant using digital technology and 3D printing in a really straightforward, non-invasive way. So I'm sure a lot of your listeners have lost a tooth here and there over the years. So we're able to place an implant, restore and replace a tooth in half the steps and in a very simple way. So yeah, I never thought for 1 second in 2007 when I qualified that I'd be doing the type of dentistry that I'm doing today, and God knows what it'll look like in another 20 years.
Yeah, very true. Look, I've got to ask this question because we had people send me emails, and Mark was a caller. He wanted me to ask you this as part of National Dentistry Week. Why is dentistry in Australia so expensive? They always cite the example of going to Thailand or the Philippines or Singapore or places like that and have dental work done over there. Something that's been quoted by a dentist for $2,500 here can be achieved overseas for $500, and you end up getting the flight and the holiday, and you've still not added up to $2,500. So the question is, why is dentistry in Australia so expensive?
I think that's a really good question, and I think you've got to look at some of the key components of, like, say, practice ownership on my part. For example, staffing and paying our staff wages culminates around about 43% of the general revenue of our practice. So wages are so high here in Australia. We pay a fortune in lab bills, again, linked to the cost of certain things in Australia. I do find it quite frightening, though. I've seen some dental work that's been fantastic done overseas, and then I've seen stuff that's been rushed, that you can't do certain procedures in a 1 week, 2 week visit, to Thailand or wherever. So there's pros and cons to everything, but yeah, it's the cost of running a business and running a health provider in this country is very expensive these days, and that's ultimately the reason why dentistry is as expensive as it is here, Brent.
Plus, there's no government subsidies back to dentists. There's set-up costs. Buying equipment is expensive. Running that equipment is just as expensive. So there's all these other costs that people don't necessarily think of as well. And you outlined it very well by saying 43% of your costs up front are staff costs.
Correct. I think it's great that we have the Child Dental Benefit Scheme here in Australia. And I think it's a really good way of, showing young patients the importance of regular visits that they should be able to carry on as they get older. But yes, I think obviously the government's working hard to work on something for those, in their 60s and beyond. And it'll be interesting to see how that all culminates and comes along moving forward.
We're talking to Dr Garreth McBride. He is the founder of The Good Dentist in Newcastle. My last question for you, Garreth, is what does being a good dentist mean to you?
For me, a good dentist is someone who treats you like you're their best friend. You're their friend. People always ask me, if you're going to have a slogan or a tagline calling the practice The Good Dentist. And for me, it's about arriving a stranger and leaving a friend. So when you're in the chair, I think any good dentist should treat you like a family member or a best friend, and putting your interest in your health as the number one in the whole interaction. I think being a good dentist is all about connection as well, Brent. You've come to see me yourself, and I love our chats. I love hearing about what's going on in your world. And I don't think there would be any good in any interaction without the patient. So there's so many things go into that. But fundamentally, it's connection driven, it's trust driven, and and it's basically about keeping alive some of the old things, some of the old traditional things about being a dentist from back in the day. You know, that
well answered.
Pillar of the society, you know.
Well answered. You're a friendly guy. You like a chat, and it's nice to. And on the patient side of things, you know, I think one of the most important roles of a dentist is to relax the patient. No matter what age that patient is, young or old, if you relax the patient, that's half the battle. Because a lot of people are anxious, very anxious, when they go to the dentist.
100%. It's always good to have a bit of banter. But I think you also I think we get as much out of, as dentists, we get as much out of your visit as you should. You know, it's great to be able to rub shoulders. We've got some wonderful patients here in Newcastle, and we all love what we do, so we can't wait to continue doing it.
Thank you, mate, for your time today. I appreciate it on National Dentistry Week. Good to talk to you, Gareth.
Great to talk to you. Thanks for having me on. Thanks, Brent.
Pleasure, mate. Bye-bye. He's a good man, he is, and he runs a good practice. It's The Good Dentist. And look, it is National Dentistry Week, and I thought we'd catch up with Dr Garreth McBride this afternoon.